One thing for me that was like a big shock was kind of I think the emphasis on professionalism, which I absolutely hated.
I was going to touch on that.
Yeah. Because like for me, like
it's a different breed.
Yeah, it is. Like when pre-hospital medicine or being a paramedic or an EMT, there's a lot of dark humor, and not that we throw that away being, a PA, but I feel like the culture is a little bit different, and they talked so much in PA school about professionalism, and I hated it. I was like, why are you guys like shoving this down our throats so much? Like, I don't care about professionalism. Like, I'm going to be who I'm going to be. But the longer I do it, you actually kind of do see that gap, I think. Especially with like newer paramedics and newer EMTs that haven't, established their own culture. Like people like Casey, you see as a professional, whereas the new ones, I feel like they're joking around too much. They're writing off patients. They're not taking the job seriously. And I did that a ton when I was an EMT. Like I worked with Matt, and I won't say his last name, but you guys probably remember him. He was with the private ambulance for a long time. But when I was an EMT about 6 months, I was starting to get a little comfortable, and I'd be like, oh, I kind of know what I'm doing. My handoff reports are pretty good. And I started like writing off patients. Like we'd bring in a drunk patient and my report was terrible. I'd be like joking around like, oh, I rule out hypoglycemia, his blood sugar's normal. Like just trying to joke around, like not taking it seriously at all. And Matt kind of took me aside and said, hey, like we need to be a little more professional here. Like, yeah, this is a drunk patient we're bringing in. Like, yeah, they're not high acuity, but you need to like talk about your assessment, why you don't think this is a trauma, head injury, and like give a legitimate report and like take the job more seriously. And that kind of changed, I think, the trajectory of where I was going to I was getting really flippant is kind of the word that I use. Cause like I would just write people off, wouldn't take the job seriously. And not that you can't have fun, but at the same time, there's a level of professionalism that we all need to have. And Matt, in multiple instances similar to that, kind of changed the way I was going. I think in EMS to take the job more seriously and be more professional. But what are you guys' thoughts?
When I started in EMS, I felt like I had a lot to prove, right? Very steep hill to climb to prove that I belonged, right? Your uniform had to be pressed. Your collars had to be starched. Your shield had to be shiny. Your boots had to look nice. Pants had to be clean. When you came to work early. Your ambulance had to look pristine. And there were a lot of guidelines as to how you were going to perform your duties when you went into service, right? Get the calls quickly, conduct yourself in a certain manner with the fire department because, we were a private ambulance service, and perform in a way with the hospital systems where you were an asset to the team and not just somebody who was a ride to the hospital for a patient, right. A taxi. So there was a lot of emphasis on professionalism, mastering your craft, and knowing what you were doing. There was a lot of teaching, a lot of 12-bit interpretation, a lot of pharmacology, a lot of pathophysiology, a lot of book reading. After every call, if you had an opportunity, look through your Merck manual. I used to carry my Merck manual. My first couple of years as a paramedic, even as an EMT, I would read between every single call because I didn't know. Even something as seemingly simple as an aortic aneurysm, like seems like if you know the anatomy, you know where the vessels are, you know what the dangers are. There's not a lot you can do pre-hospitally, if it's going to dissect, but I would still look that stuff up, I'd say, okay, let's, I have to know what I'm doing. I have to prepare every patient to be managed appropriately in the hospital. If I don't prepare this patient effectively to be received by the hospital, I'm doing the patient a disservice. So that's that level of professionalism that I felt like was the standard in the EMS when I started.
Everything you hear today from myself and my guests is opinion only and doesn't represent any organizations or companies that any of us are affiliated with. The stories you hear have been modified to protect patient privacy, and any resemblance to real individuals is coincidental. This is for educational and entertainment purposes only and should not be taken as medical advice nor used to diagnose any medical or healthcare conditions.
And when I got hired to work for the company I worked for, they were an elite group of people, and people would talk to me about that, like, hey, we're good, and we know we're good, and we do a good job, and we're proud of the work we do here. And the standard's not going to change just because you're new, So that was the service that I was born into. And that introduction gave me a lot of pride. I wore my uniform for the first year. When I put on my uniform, I felt like, that I was an imposter, right? Like I'm just pretending to be the guy that is these guys. I want to be part of their team. I don't feel like I'm there yet. And I relied a lot on, our agencies that we worked with. I relied heavily on my partners. Like, hey, can you help me figure this out? I don't know what's going on. I'd ask for feedback from nurses and doctors and say, hey, look, what I do wrong? Is there anything I can do better? This is where my thought process is. And I would really try to do that. When I transitioned to PA school, I felt like the culture was somewhat similar to that, except it seemed much more cerebral. I felt like the paramedic world that I was in was more blue collar, more physical. Like you're not just going to think your way through a problem. You're going to do everything that's necessary and wear many hats. You're going to carry somebody up a hill. You're going to move somebody who's large out of a bed into a wheelchair, or off the floor. You're going to put your body in vulnerable positions. You're going to kneel on the side of the road in some sort of liquid that you don't know what it is, or you're going to accidentally kneel in somebody's bodily fluids that they've been laying next to for 2 days, So like as a paramedic, you kind of wear that hat where the culture is, you just need to be prepared for everything, but you're going to be blue collar because, you have to do the jobs that not everybody wants to do, but when you get into PA school, there was an emphasis on being very professional, right? For me, I kind of interpreted it as, now you're not, now you're going to wear a white collar, now you're not just the face of, an aspect of medicine. You're the face of all of medicine now, right? You are a direct, representation of the top of medicine, right? Specialists, family practice doctors, they all look the same, right? They wear scrubs or they wear white coats or they wear ties, whatever, And when I, transitioning to PA school kind of gives you that opportunity to reflect on the kind of person you have to be when you represent medicine.